All right, so we are on. We know that some people are watching us already, and as soon as we get the go ahead for Facebook Live, and it looks like we are live on Facebook. So welcome everyone to a very special town hall that we're having here today. Just it's such an important one where we get to really hear about science, about data, and about the community. And a whole lot more. So let me just give a quick welcome. My name is David Kelmnick, the founder and also president and CEO of the LGBT Network. The LGBT Network is a 26-year-old organization that provides a wide range of health and human services and advocacy, community organizing, you name it, for our LGBTQ communities in Queens and the rest of the boroughs in New York City and Long Island. As I said earlier, this is our largest town hall attendance ever. So thank you all for joining in. I know I saw that we have so many of the groups we currently work with throughout the city and throughout the state. We have a lot of folks from our state health department, our New York City Health Department, and it's really great to see everyone coming together to hear from Dr. Blackstock about the challenges that our LGBTQ communities are facing. And particularly those living with HIV during COVID-19. And also just quickly, we know that we're coming up on Pride Month, and we will be doing Pride in a different way this year, but it doesn't mean we won't be celebrating it. So, as we say here at the LGBT Network, just because we're in doesn't mean we can't be out. And we will be out in a big way. So we're going to be releasing information in the next couple of days on our virtual New York Pride that will take place in June. It'll be a whole bunch of programs during the month of June, but also a big Pride celebration that will have guest speakers, entertainers, and you name it. And for more information on the LGBT Network's programs, you can go during the time that we cannot have our community centers open in Long Island City and beyond. Go to lgbtnetwork.org/virtual center. A lot of programs going on. So today's topic is challenges facing the LGBTQ community and those living with HIV/AIDS during COVID-19. We are lucky and fortunate to have one of the most respected healthcare professionals that will be, that will be providing so much important information, Dr. Oni Blackstock, the Assistant Commissioner of the New York City Department of Health Bureau of HIV. We are live on Zoom, on Facebook. Please consider hosting a watch party if you're on Facebook now, so more people could hear the important information that Dr. Blackstock is going to share with us shortly. You can also begin to send your questions to us in Zoom and also on Facebook, and we will try to get to as many of those as possible. So let me just introduce our guest here today, and then I'm going to turn it over to Dr. Blackstock. But today we're excited to have with us Dr. Oni Blackstock, a Brooklyn native who is the Assistant Commissioner for the New York City Health Department's Bureau of HIV. Dr. Blackstock oversees the city response to the HIV epidemic. Dr. Blackstock is a primary care physician, an HIV specialist, and researcher who sees patients at Harlem Hospital's HIV clinic, where she has developed, implemented, and evaluated innovative community and clinical-based programs to promote HIV treatment and prevention. She received her undergraduate and medical degrees from Harvard University and her Master's of Health Services Research from Yale School of Medicine, Robert Wood Johnson Foundation Clinical Scholars Program. God, is that impressive. She was trained in primary care internal medicine at Montefiore Medical Center in the Bronx and completed a fellowship in HIV medicine at Harlem Hospital. Dr. Blackstock is passionate about racial equity and social justice and is committed to ending the HIV epidemic amongst all New Yorkers. So thank you, Dr. Blackstock, for all that you have done in the past, present, and what we know you will do in the future. When we talk about our frontline heroes and being, so appreciative of our frontline heroes, you have been on the front line for us for so long. So thank you.
Thank you so much, David. Thank you for that introduction and for having me on. So I'm going to share my screen. And as I'm doing that, just want to speak to the important work that your organization is doing. So thank you. Okay, oops, sorry. Let's go back to here. Okay. So I'm really excited today to be with you to share a little bit about New York City Health Departments and specifically the Bureau of HIV's response to the COVID-19 pandemic. And I just want to also recognize, I know many of us either have been personally affected or have had loved ones affected by COVID-19, as well as had loved ones pass away from COVID-19. So I just want to recognize that we are all going through a daily trauma, with some being impacted more than others. So I just wanted to make sure to recognize that. So just briefly, I'm going to give an overview and let you know about the progress towards our public health milestones related to COVID-19. Then speak briefly about the intersection of COVID-19 with LGBT health and HIV. And then lastly, speak specifically about our health department and Bureau's response to the pandemic. So beginning with the overview and progress towards our public health milestones. So as many of you know, the COVID-19 pandemic continues worldwide. And I'm sure if you're listening to the news, you've heard that suppression has been achieved in some areas, but the outbreak is also accelerating in other areas as well, including in the United States. Since the first confirmed case of COVID-19 in New York City, over 21,000 people have died from the disease. And so following a peak in early to mid-April, we've seen daily case counts, so the number of people who test positive for COVID-19, those hospitalized for COVID-19, and those who died from it, that has been declining steadily each day. And this really suggests to us that the mitigation measures that we're using, such as physical distancing, face coverings, are working, and that measures must be maintained as we prepare to transition to what we're calling the suppression phase. Just to make sure we're all on the same page, I know many of you know this already. COVID-19, what is it? An outbreak of respiratory disease that began in Wuhan, China. It was identified first in December 2019 and thought to have originated in animals, specifically bats, that then infected humans who came in contact with the bats at a live animal market in Wuhan. Testing by scientists revealed this was a brand new coronavirus. So the family of coronaviruses is common. It can often cause the common cold, but can also cause very severe disease, as in the case of this novel coronavirus. The disease caused by the virus was named COVID-19. Just in terms of symptoms, you may know that many people can have COVID-19 and be asymptomatic, meaning they have absolutely no symptoms. People can have mild disease, moderate, and then severely, people can present with severe illness. Most common presentation is cough, difficulty breathing, fever, chills, muscle pain, sore throat, and what we're seeing a lot with this virus, although other viruses can cause this as well, new loss of taste or smell. Others have presented as well with nausea, vomiting, and diarrhea. And we know that older adults don't always present with focal symptoms like a cough or fever. They may present with confusion, disorientation, or falls as well. So in terms of the incubation period for COVID-19, that's the period between once someone is exposed to infection, someone who has it, to the time that their first symptoms appear. That ranges from 2 to 14 days after exposure. Everyone should know that treatment is supportive, so usually oxygen or mechanical ventilatory support if needed. There are currently no FDA-approved COVID-19 specific treatments available. The FDA actually did approve with the emergency use agreement remdesivir, which has some limited availability, and it's only for people who are hospitalized with very severe illness. And there are currently a number of vaccines that are being studied, but there are no available vaccines at the moment. Most people with mild to moderate illness can recover on their own. And so if people are at home and not feeling well, after a few days, they should call their doctor. For folks who are older or who have other chronic medical conditions, they should call their doctor immediately so that they can be monitored. So who is most at risk? With community transmission, which is what we have, where there are many people in the community who have this illness and can pass it to others, all New Yorkers are at risk. The following groups are at greater risk of severe COVID illness. So people who are age 50 and older, particularly those who are age 65 and older, and then people who have other health conditions like chronic lung disease, heart disease, diabetes, cancer, or a weakened immune system. We do not yet have the data, or we haven't yet done the analyses to determine whether HIV in and of itself is an independent risk factor for severe illness from COVID-19, but we are in the process of gathering that data. We do know that people living with HIV in New York City, more than half are over the age of 50, and that HIV in and of itself is associated with a number of other sort of chronic medical conditions. So all those things could put someone living with HIV at risk for severe illness. So as I was mentioning, we have been seeing steady declines. And so these are 3 graphs showing the number of COVID-19 cases, hospitalizations, and deaths from the beginning of the pandemic around March 3rd to recently May 17th. And as you can see, there was a peak in early April, and since then we've seen a steady decline in all of these measures, fortunately. So the timing of when to remove or reinstate physical distancing and other policies to slow the spread of COVID-19 will depend in part on trends in 3 key public health indicators that New York City is monitoring. And so these are hospital admissions, critical care capacity, and positive test rates. And if an indicator reaches a certain predetermined level or milestone for a certain amount of time, it will indicate that the spread of COVID-19 is actually slowing. So the first indicator is the number of people admitted to New York City hospitals with COVID-like illness. So that means people who come in with fever, shortness of breath, and all of the symptoms that I had mentioned. And that has remained below this line for more than 10 days, which is incredibly encouraging. So we're seeing a low number of hospital admissions for people presenting with COVID-19 like illness. This is looking at the daily number of people in critical care across New York City's health and hospitals. And as you can see, the number of people who are in critical care is slowly trending down as well, not yet below the line, but heading there. And then this is looking at the percent of New York City residents who test positive. So of those who've had a test, the number who have had a positive test. And we want that line to be below 15%. And as you can see, for at least the past 9-10 days, it has been below the 15% line and continues to decline. Many of you have heard on the news, I'm sure, and have been personally affected by COVID-19 deaths, and knowing that there are significant inequities that we see in who's dying by race ethnicity. This graph looks at the rate of death by race ethnicity. As we can see, Latino and Black New Yorkers have the highest rates of death, almost 2 times that of their white counterparts. And then this is looking at COVID-19 deaths by borough, and we see the Bronx and Queens disproportionately impacted. And then lastly, this is a graph showing, a map showing the percent of patients in different zip codes in New York City who test positive. The darker color represents a higher percentage of positive tests. So as you can see, large swaths of the Bronx, Queens, some parts of Brooklyn have a deeper blue color, suggesting higher rates of COVID-19 in those areas. So now I'm going to move on briefly to talk about the intersection of COVID-19 with HIV and LGBTQ health. And before I start that, to just say that the health department is working as part of its response to really focus in and prioritize the neighborhoods that are being most impacted. In terms of COVID-19 and HIV, I was just talking to David beforehand, and we were talking about how there are aspects of this COVID-19 pandemic that mirror the HIV epidemic. One of those being that those who experienced the early days of the AIDS epidemic in New York City may be experiencing anxiety and other emotional responses because of the similarities. For instance, concerns about the pace of the government response, concerns about it being inadequate or delayed, anxiety about one's own vulnerability. When I have done town halls with people living with HIV, and even for people I know personally who are living with HIV, many people are worried about whether having HIV increases their risk of COVID-19, and we don't yet have that data. And then also seeing the inequities and vulnerability, how different communities are being impacted, and also knowing that people have different access to healthcare and other support services. We also know that because of shelter in place, many people may be experiencing increased social isolation and feelings of loneliness as people may be more isolated from their support network. And we know the importance of having social contact, sexual contact, and how important those can be for our overall well-being. So our recommendations in terms of people living with HIV is that people with HIV should generally follow the same COVID-19 related guidance. Most people with HIV do not need to take additional precautions because, as I mentioned, currently there's no evidence that HIV is associated with greater risk of severe illness. Obviously, if someone has a low CD4 cell count below 200, and so if they're immunocompromised or their immune system is weakened, we would want them to take the proper precautions. So people with HIV should take the following steps to protect themselves, ensuring an ample medication supply, so up to 90 days supply if possible, and we know that Medicaid and ADAP have allowed for this to happen. So far, we have not received any reports of HIV medication shortages, fortunately, and we hope that we don't anticipate any. But we'll definitely keep the community apprised if we hear of anything. Use telemedicine visits if available, weighing, excuse me, weighing benefits and risks of attending clinic in person versus in person with your healthcare provider. So really talking to your provider and saying, is this something I need to come in for, or can this be delayed? Does my risk of getting COVID-19 outweigh my risk of not coming in for care? And getting recommended vaccinations for flu and pneumonia, because those are still out there and you want to make sure that you do not make yourself vulnerable to other infections. In terms of COVID-19 and LGBTQ health, we know that some members of the LGBTQ community may be at greater risk of infection, particularly those who maybe make their living through in-person sex work. We know that LGBTQ persons who are older or have pre-existing conditions, again, may be vulnerable to severe illness. As I mentioned, for people living with HIV, there is worry about the social isolation. We know that people greatly benefit from social and mental health support that in-person services and social gatherings can provide. And we know that many of these have gone virtual, but may not have the same resonance with people. It's interesting. One of my patients has to shelter in place. He is queer and he has to shelter in place with his family who are homophobic, and it has been incredibly challenging for him. And so it really brings up this issue that we know that LGBT youth in non-pandemic times are at increased risk of depression, anxiety, substance use, and suicidality. And then if we layer this pandemic on top of it and people are having to shelter in place in situations in which they do not feel comfortable or accepted or safe, that can increase the risk of these poor mental health outcomes. Physical distancing may have negative consequences, again, related to being confined to an environment, as I said, that's unsupportive or abusive. Also related is that we know that LGBTQ adults have higher smoking rates compared to non-LGBTQ people. And smoking is believed to increase risk of more severe cases of COVID-19. So we want to make sure that the community is aware of that. And if people are interested in quitting, that they reach out to their providers for help in doing so, including access to smoking cessation medication. We know that many LGBTQ people are employed in sectors that are heavily impacted by COVID-19. So healthcare, food services industry. So many people have lost their jobs as a result of this. We know that even before the pandemic, 1 in 10 LGBTQ people were unemployed and more likely to live in poverty compared to straight and cisgender people, meaning that they cannot always afford the healthcare that they need. We also know that there is systemic discrimination in housing, employment, and healthcare that works to increase the risk of poverty among many LGBT groups and exacerbates health disparities. We know that older LGBTQ people are twice as likely to live alone, 4 times less likely to have children, and so again, increasing the risk of social isolation. and having to go out to get one's own groceries and therefore putting oneself at risk. And then LGBTQ youth, we know, are more likely to experience homelessness, unstable housing, or live in foster care. The really wonderful part is that we know that a number of agencies have really stepped up to provide virtual online support groups to both older LGBTQ people as well as youth as well. Now I'm going to share briefly a little bit about the health department's response and talk to you a little bit about the Bureau of HIV's response to the pandemic. So just globally, our health department's response includes many different objectives. Some of these are to conduct enhanced surveillance to track disease spread. So we get data on everyone who is tested positive. I think actually everyone tested for COVID-19, particularly those who test positive. We educate the public through webinars such as this, virtual town halls, social media, guidance documents, and ad campaigns. We also provide guidance to healthcare providers, hospitals, nursing homes, and other healthcare facilities. We have a public health lab that conducts lab testing, and we also help to plan for the surge that we experienced in early May in terms of distributing medical equipment to providers, building a volunteer and paid healthcare workforce, and assisting with setting up a number of alternate care spaces like the Javits Center that was used for some time for overflowing for patients who were coming from hospitals. Specifically around HIV, just to make sure everyone is aware that we have a great deal of support from the city as well as the federal government, but we have a New York City Ending the Epidemic Plan for HIV that includes a 4-part strategy building upon the state's blueprint to end the epidemic. And there are 4 main objectives: increasing HIV prevention services, promoting optimal treatment for HIV, enhancing methods of tracing HIV transmission, and advancing sexual health equity for all New Yorkers. And so we are coordinating our response to the HIV epidemic and now COVID-19 pandemic, including work around HIV testing, prevention, surveillance, policy, community engagement, lots of good stuff that we have done and are continuing to do. As I mentioned, one of our core functions as a health department is to provide guidance to the public as well as providers. So early on in the pandemic, we, in collaboration with New York State, developed a Dear Colleague letter for HIV care providers to provide them information on COVID-19 and HIV. We also distributed a similar guidance for people living with HIV who may have had questions about HIV and the risk of COVID-19. We also developed guidance on maintaining HIV and STI service during COVID-19. So for instance, if patients need to start PrEP, how does that happen? We have a PEP, post-exposure prophylaxis call center that we want to make sure that people know about and can call into and don't have to come in to get an HIV test. An HIV test can be sent to them, as well as a prescription for their PEP medications. We developed guidance on sex and COVID-19 because we know that sexual health is in part of overall health, and that we want people to know how that they can have safe sexual and pleasurable activity while reducing the risk of spreading COVID-19. And the take home for that guidance is that you are your safest sex partner, followed by a consenting adult in your own home. And then if you do want to have sex partners outside of your home, try to have as few as possible and try to stay consistent with those number of partners if possible. We are supporting a number of contracted agencies, and we continue to do so during COVID-19. We're maintaining regular contact with both our clinical and non-clinical organizations that provide HIV prevention and treatment services, offering technical assistance. We have helped support these organizations in pivoting to telehealth and ensuring that there are no interruptions in funding, because we know that they also have staff that are relying on their salaries to live, as well as provide healthcare and health insurance. In terms of some of the ways that we've adapted during the epidemic, during the COVID-19 pandemic, is for our Ryan White, which are services to people who may have low incomes who are HIV positive. We have expanded our Ryan White Part A funded food and nutrition services, as well as emergency housing assistance. We lifted the cap on the number of meals per week clients may receive, have arranged for home delivery meal vouchers, and transitioned our congregate meal programs to meals to go. We had, before this, a community and online home HIV test giveaway. The online home test giveaway focused on men who have sex with men and people of trans experience who have sex with men, and that was primarily advertised on dating websites and hookup websites. And then we had a smaller community home test giveaway. And what we do, we've merged those so that clients at our funded agencies and any other agencies that want to be part of this initiative can provide clients with online coupon codes to order free test kits for home delivery. And then we continue to promote these kits through social media, text messaging, and email. And then we have a very large surveillance and partner services unit that actually goes out to interview almost everyone who's newly diagnosed with HIV, as well as their partners. And all of that work has transitioned to phone and video calls, and we've still been able to work to link folks to services as needed. You could also know that 2 of our sexual health clinics are currently open, the Chelsea Sexual Health Clinic and the Fort Greene Sexual Health Clinic in Brooklyn. Both offer limited walk-in services for post-exposure prophylaxis. So that's after you've potentially had a high-risk exposure, emergency contraception, and Jumpstart. Jumpstart is for people who are newly diagnosed with HIV or people who have been diagnosed with HIV but may not have ever started medication. There's also a hotline. Telemedicine services for STIs and HIV are available Monday through Friday, 9 to 3:30 through our sexual health clinic hotline. And then we've also done a lot of work engaging with our community partners through virtual meetings and town halls, including the HIV planning group, the HPG, which is a HIV Prevention Community Advisory Board, and our New York Knows partners. So just winding it down a little bit, also wanted to mention that in April 2020, the New York City Unity Project released LGBTQ plus COVID-19 online guide full of lots of services that are available at LGBTQ affirming city and private nonprofit programs. And the health department contributed to that effort. And then so that you know, the New York City Unity Project, Health Department, and H&H will be hosting on June 2nd an LGBTQ plus health and healthcare COVID-19 virtual panel discussion, which will cover a number of COVID-19 related health topics that are relevant to LGBTQ New Yorkers, such as sexual health and relevant services, behavioral and mental health services, healthcare rights, and health-related emergency response activities. And that is it with my presentation. That's all for now, and I'm happy to answer any questions that you might have.
Great, great. Thank you so much, Dr. Blackstock. And you know, one of our viewers said something I think we're all feeling is thank you for sharing all of this important information and these important points. And it is so I'm trying to figure out how to get us back. Oh, I think we have to stop share, right?
Yeah. I'm going to stop share.
I'm trying to do that. There we go. So, you know, I think it's a breath of fresh air to get facts, to get science, and not to get, you know, some of, you know, we could probably say it a little bit more, you know, some of the mishigas, as we would say,
Mm-hmm.
you know, from, and that's putting it nicely, from Washington, D.C. So thank you so much for that. So,
You're very welcome.
you know, so we do have a few questions, and I just want to follow up on, you know, just a couple of things. We talked about it a little bit beforehand, but I know we have searched for the data. Other people have asked, has there been a collection of data on, you know, people who are positive with COVID-19 and the number of LGBTQ folks?
Yeah, so the health department has started to collect SOGI data, or I'm sorry, sexual orientation and gender identity data for patients that we are interviewing as part of our case investigation. Unfortunately, we don't receive SOGI data for lab reported cases because not all lab reported cases are interviewed. So only the folks that we're interviewing. And we're working to really improve the data collection. As I mentioned, we're hoping that it's going to be part of this larger contact tracing effort that's happening. So when cases are identified, so two-step questions will be asked. We get that data so that we know what the representation of LGBTQ people are among cases. Right now, the number of deaths that we have identified are too small, and obviously suspect that that's an underestimate since we don't have all of that complete data yet.
Sure. Thank you. And then one other thing about the FDA policy on blood ban. If you want to just speak a little bit toward that.
Yes. So the blood supply is really dependent on people donating blood at various blood donation drives. And because of the pandemic, there's been obviously much fewer of those drives happening. And so as a result, we've had a significant reduction in the blood supply. It's actually at very dangerously low levels, particularly here in New York City. And so as a result of that, the FDA announced in the beginning of April changes to the blood donor eligibility criteria. So prior to April 2nd, men who had sex with men had to defer donating blood for 12 months. And women who had sex with men had to defer donating blood for 12 months. That deferral period was shortened to 3 months. It's headed in the right direction, but we still think that people should be, basically everyone, not men who have sex with men and women who have sex with men who have sex with men, should not be targeted. Everyone should be asked about their behaviors, and really anyone who has condomless sex should then be tested for HIV. Anyone who tests negative should then be able to donate blood. And people should also know that after blood donations, everything's pulled together and there are actually tests done on the whole supply. So that happens already. But we just think that these are limitations to people being able to donate. And we've unfortunately heard that this reduction in the deferral period is not being implemented at all sites. So we want to make sure that if people do go to give blood and they're asked about their sexual activity and they are told that they cannot give blood, that they know to report that to CCHR, which is like the Human Rights Commission here in New York City.
Okay, that's very, very important information. Thank you.
Yes, so just to say, I know I keep on saying deferral period, that means that you have to wait 3 months, abstain from sex for 3 months. If you're a man, cis man, abstain for 3 months until you can donate. And if you're a woman who has sex with men, wait 3 months. That used to be 12 months. We would like to see that go down to 0.
Sure. And we know we're headed in the right direction with that, although the right direction would be to eliminate it altogether. Yeah. That's the only way we can have equity. And we've seen a couple of other nations during this time just completely eliminate it. Is it Hungary and
is it really?
Yeah, there were 2 nations I just read last week.
Oh, that's great. That's really encouraging.
Yeah, so hopefully the US will catch up. If not now, November 4th. But we have a few other questions, and there are 2 questions around PrEP. Mm-hmm. One from Terrence says, how has the coronavirus affected the need for and availability of PrEP?
Yes, so that's something that we are able to track, at least at the agencies that we fund. We have seen reports, we've seen data from all the agencies that we fund, both clinical and non-clinical. So our clinical agencies, they prescribe PrEP. Our community-based organizations, they will link someone to a clinical site that prescribes PrEP. We've seen the declines definitely over the last few months in the number of people who are coming and wanting PrEP and getting linked to PrEP and being prescribed PrEP. That's happening. We do want people to know that there are lots of agencies, and I believe I can send you the link for this. We do keep an updated list of all those agencies in New York City that are accepting new PrEP patients. So if anyone has any questions about that, we do have a resource online that can be accessed to see where people can get PrEP. PEP, post-exposure prophylaxis, there is a hotline that can be called 24/7 if people need access to that.
Mm-hmm. Okay, so what we're going to do, just for everyone, all our viewers out there, is that we're going to post all these important resources that the New York City Department of Health and the Bureau of HIV provides. We're going to get those sample letters up as well, if that's okay, the colleague letters, so that everyone could have these resources whenever you need it. We're going to have that put up on the LGBT Network Facebook page. So we have a question from, and I believe you answered this already, the other question about PrEP from Christopher. How are you providing testing for new and current PrEP patients?
Okay, so each clinical site is has their own protocol, but as I mentioned, we have this virtual community home test giveaway. So for instance, I see patients at Harlem Hospital. So for instance, if I have a patient and I'm concerned about them having to go into the lab to get tested, what my PrEP team has done is they can send them a code, which they then go online and they can have the home HIV test mailed to them so that they can then self-test.
Mm-hmm.
So some organizations are doing that. If someone is being adherent, like I have some patients I talked to and they said, "Doc, I've been taking my meds every day." We're actually delaying checking their test because it's probably very unlikely, and maybe they have the same partner, and it's probably not worth having to come in. So that's also happening. For anyone that I'm worried about, like I had one patient who was taking PrEP on demand, but when we talked about it, it sounded like he was actually not taking it in the prescribed way. So for him, I was like, I need you to come in to get tested. So every situation is different, and I think providers are maybe sort of using their clinical judgment with each case.
Mm-hmm. So speaking of a data question here, is there any, from Jeffrey, is there any data available on changes in incident reports of HIV, syphilis, or other STDs since the COVID pandemic began compared to other previous periods? Or is that yet?
Yeah, we have not yet had a chance to track rates, but rates of positive tests, but we do know that there are 30 to 60% declines in the number of tests being done. Mm-hmm. But I need to figure out whether we are also seeing sort of a similar trend in the proportion of positive tests, if that makes sense.
Sure.
So there's just a lot less tests going on for HIV and STIs happening.
Mm-hmm. Well, as one of the organizations that provides HIV and STD testing, what are your recommendations? We have a lot of nonprofit partners on this call.
Yeah.
So what are your recommendations, or what do you think is going to happen as we start to get back?
Yeah, I mean, I think for STI testing, what is happening, there's that sexual health hotline, health clinic hotline that exists, and what they're doing is syndromic. It's called syndromic management. So if someone calls in and they said, I was just with my partner, and my partner maybe had some discharge, and I think he says he thinks it's this, he had this, like there's like an actual algorithm that the provider goes through on the phone and determines like what medication to prescribe them. So without people having to come in to get tested, we can sort of deduce clinically what the person might have, and then send an electronic prescription so that they can then go pick up or have the medication delivered to their home. So that's happening a lot with STI testing. The CDC, the health department promotes that approach. Obviously, if someone is not responding to the medication, that may be an indication that they need to be seen in person in clinic. And then same thing with HIV testing, where the CDC is really interested, and the health department too, in expanding the self-testing. I think someone asked a question about like the window, because we know that it's not as, we're using OraQuick, it's not as sensitive, and there can be a window period. For those folks that we are worried about and that need a more sensitive test to detect HIV, we are having them come into the lab to get that done.
Okay, and there is a home test kit program, as you mentioned.
Yes, I believe the link may be in the presentation, but I'll work with Adrian, my external affairs person, so we can get all that information to you.
Sure, and we'll post that on our Facebook page as well. So as we were talking about this to some degree before we got on to our live session, and one of the pieces of information that you put out for the community was sex and COVID. And so there's a question here: is it true that coronavirus can be found in semen and vaginal fluid? Is that also a means of transmission? And I know that there's some more data that has just come out.
Right. Yes. So right, as David was intimating, like it's evolving, and we're learning so much about this virus, and so virus has been found in semen. So that came out like a week or two ago. We don't know whether the virus in semen is infectious virus. You know what I mean? So you can have like viral particles, but that can't cause infection, so can't transmit to others. So we don't know that about, so virus has been found in semen, but we don't know whether it can be transmitted from the semen to someone else through sex, or just by touching. We have just, in vaginal fluid, it has not been identified in vaginal fluid. So semen, yes, but we don't know whether it can be transmitted. Vaginal fluid has not been identified in vaginal fluid. And just to throw in there, feces has been identified in feces, and apparently the virus in feces can be viable, meaning that it can potentially be passed to someone and cause disease, so either orally, or it could be, we call it aerosolized, so that someone can breathe that in.
Sure. So you definitely want to stay 6 feet 6 feet away, right? Or not in the same bathroom. But we have a question from Clifton. So where the summer is almost here, and his question is the high temperature and humidity weather, will it help to stop the spread of coronavirus? So we've heard, somewhat that warmer temperatures, folks, the virus may not be as transmittable. I mean, what are your thoughts on that?
Yeah, I don't know. This still, there's some suggestion that I think light may affect the viability of the virus, but I do think we're seeing coronavirus affect, places in the Amazon that are warm and humid. So I think it's unlikely to really change the course of things. Summer's coming. I think what is helpful is that when people are out, so being outdoors and being able to spread out outdoors, obviously the likelihood of being able to transmit to someone else is decreased versus like if people were all indoors together. So I think that's what people are kind of looking forward to, the warm weather, people can be out and about, but maintaining a physical distance. We know that exposures tend to happen when people are very close to each other and like talking for like 15, 30 minutes. So that's why it's still important when you're outside to wear like face coverings. Very brief encounters are unlikely to pass the virus. So if someone's like biking past you or they run past you, it's very unlikely, but having your face covering on can also further reduce the risk.
Sure. And we've heard that a lot lately, and until the foreseeable future, wearing a face mask will be a preventative measure.
No, totally. And it's so funny, right? Like at the beginning, remember when the CDC came out maybe like a month ago, whenever it was, and they were saying face covering, and people were like, what? And now it's become the norm, right? Like we're depending what part of the country you live in. But, for us here in New York City, like many people are abiding by it and wearing it, and it's become a part of our lives so quickly.
It has. I mean, and I've heard from some people that are coordinating their outfits with their face masks. So
no, totally. I just saw a picture of from another country where people did that. And it was quite beautiful.
Yeah. So there's another question from Christopher. What about blood tests for liver function?
Okay, so if someone is taking a medication where their liver function needs to be monitored, I think depending on what the risks are, if there's like a lot of concern for harm to your liver from the medication, then talk with your healthcare provider, and if they work with them, and if they think that it's indicated and you feel like you want to go in as well, get that lab test done. But many times, many of these tests can probably be deferred for a little while. Like we're trying to just wait till a time where we're more in suppression phase, which should be happening soon as we see all those cases coming down, just so that folks aren't risking their safety by going out. But that's like a shared decision-making conversation you should have with your healthcare provider, so that you can weigh the benefits and risks and like what your personal preferences and values are that relates to that question.
Definitely. And, just a word from Francisco on face coverings. They'll just be another accessory we wear, like a scarf or gloves in the winter, right?
Totally. I saw one, I like the ones where it's like a little like cat, like a cat or a dog. Like I was like, those are so cute.
And so, this isn't on behalf of my my nonprofit, obviously, but, personally, I've ordered my Joe Biden for president.
Okay, the face mask?
Yeah.
Oh, cool. Okay.
Yeah. So it's important to wear that so people can know why we're wearing face masks. But
yeah, I think I'll wear my healthcare for all or something, or Medicare for all.
Yeah, so you can have your, we still could, a new way of advocating for
Yeah.
justice, right?
Mhm.
Which is on the mask. So also from Francisco that they'd like everyone to know that ADAP is up and running, helping
Yes.
clients. So they've allowed for 90 days
Yes.
for prescriptions on formula. I don't know if you want to say anything else about that.
No, I briefly mentioned it during my presentation, but yeah, just to thank you for sharing that again and driving home that point to everyone.
Yeah. And then there's a question about the MTA. So Cliff has heard that the report that the MTA was planning on using UV lights to stop the spread of COVID-19, and the MTA shut down from 1 a.m. to 5 a.m. And the question is, do you think the high humidity weather, or we kind of talked about this already, but high humidity weather could be good enough to stop the spread of coronavirus? And what about the use of UV lights to stop?
Yeah, unfortunately, I don't know enough to speak knowledgeably on it. But I think all the other measures that they're taking with obviously the increased cleaning, we'll talk how people who are homeless are being treated is another issue, which we'll talk about maybe another day. But the increased cleaning obviously is important. And then particularly for the folks who work for the MTA to be able to have access to like PPE and all of that, which I think is now happening, is really important. The UV light, I don't know as much about, but I think what's important to recognize is that like we will have I think everyone knows this, a new normal. I don't think we will go back to how things were, and if we do, it won't be for some time. I think this is going to be with us. This is going to be with us for a while,
right?
Until there's a vaccine. And just so folks know, like, the vaccine development process for this is being dramatically accelerated. Usually it takes years to develop a vaccine. From HIV vaccine research, that's been studied up the wazoo and still no vaccine has been found. So I think we're going to have to make these changes and adopt these changes in our lives in order and just find a new way of living and a new way of socializing and being together with each other.
Yep. And right now, while we have to be physically distant somewhat, we don't have to be emotionally distant.
Right, exactly.
It's important that we're out there supporting one another. So there's a question about testing availability. And Colin is asking, can you speak to that? The public assumption is that testing is impossible to come by.
Yeah.
Anecdotally, it seems that the swab and antibody testing are now both readily available.
Yeah, the city has 25, H&H Health and Hospitals has 25 free walk-in testing sites, and people can find those by going to nyc.gov/COVID test. So it's nyc.gov/COVID test, or by calling 311. There are also an additional 5 testing sites through One Medical. So if you just do New York City testing, you'll find it. CityMD is also partnering with New York City to expand free testing, and they have 123 walk-in sites. So the recommendations though people should know for testing are for those who have symptoms, for those who've had a close contact with confirmed COVID-19, so that's someone you live with or intimate partner, and then people who work in congregate settings like a nursing home, adult care facility, shelter. Those are the folks who at this time are being recommended for testing.
Got it. Thank you. And we'll share those resources again on our Facebook page and make sure it's easily.
Yeah. And that's for testing to determine if you have the infection right now. Then there's that's molecular testing. Then there's antibody testing, which determines whether you've been previously infected with the virus, and that is also available. Folks can sign up at nyc.gov/antibody survey. I know it's like all these things. So lots is happening. Folks should know as well that it's possible to have a false positive. You could get a positive result because many of these tests cross-react with other coronaviruses that people have had. So remember I said coronaviruses are very common. So if you've had a previous coronavirus infection, you may have antibodies to coronaviruses, and so that may show up as a false positive for this one if you did not have the novel coronavirus. And then also to say, if you do test positive, we do not know if that confers immunity. That means that you are protected. We do not yet know that.
So, you know, it's interesting. There's a lot of folks, unless you watch some, I mean, I saw it recently, you know, the Simpsons many years ago talking
Yeah.
about coronavirus that, and it's listed in some ingredients of what Clorox does, I guess, in fighting off, but not the way the president has told us to use it. But so, you know, when this may seem like a basic question, but COVID-19 is named 19 because there's 18 other coronaviruses, or?
No, it's named for the year 2019.
Got it. Got it. Okay, cool. Because I know that was a question on here. So there's a question on your perspective on shared public bathrooms and infection rates.
So again, like, people are mainly acquiring this when they're in close contact for a prolonged 15-30 minutes with someone else who has the infection. So if you're going to go to a bathroom and use it, I think it's fine. Just make sure that you maintain physical distance, 6 feet, you have your face covering on, and that you wash your hands for 20 seconds with soap and water or hand sanitizer.
So follow those precautions we're all hearing about. Yep. So I have a question about opening, right? Because a lot of people are thinking about, when are we going to reopen? You gave us those metrics of what has to happen before you can reopen. And that would be phase one, right? Of what we're hearing about for manufacturing and construction. But we have a lot, you know, we're a nonprofit that's a community center, and that's sort of the antithesis of distancing, right? It's about bringing people together and building community, and we're going to have to look for new ways of doing that at our places for now. But you know, when it comes down, and we have a lot of nonprofit partners on the call with us today, what are some things that we all need to start thinking about? Because we're not going to just be able to open as we were in early March.
Right, and just to say, like, I mean, I'm sure you're familiar with the New York City mayor and governor's relationship. So, like, the milestones I showed were for New York City, but, you know, New York State they actually have their own 7 milestones that are somewhat different from the ones that we have. And so, you know, I think, you know, obviously we go with what the state says, even though, you know, the New York City has its own milestones. And so everyone should know, you know, the pause is still in effect till May 28th. And on the Cuomo's website, the state website is actually, like, really informative. They do give some details about what would be needed in order to get to the next phase. I think the main things are really around, like, safety in the workplace, right? And then, so making sure that there's, like, adequate, you know, depending on what people are doing, people have adequate PPE if that's indicated, and that, you know, just de-densifying the space, so staggered schedules, alternate days. I think all of that is going to need to be really considered. But I think that, go on.
You go ahead, Dr. Blackstock. Sorry.
No. But I think that we can find, like, a happy medium. Like, I feel it's not like a binary, like it's either closed or open. You know what I mean? Like, I think that we will be creative and innovative in terms of figuring out how we can work under the circumstances.
Sure, and to do in-person HIV testing again. You know, I know that there's a couple of people have asked us questions. Are we going to have to get, you know, the plexiglass like you see maybe some banks and supermarkets? I don't think so. But
no. Again, like, the face covering, you know, where people, you know, people who are drawing blood may have, I guess they'll be in a clinical setting. Excuse me. And then there are new requirements now, like for face shields and eye shields and various face coverings that people need to now wear, that the CDC actually recently put out. So I think once people have their gear on, they'll probably be able to, and the patient has their face covering on, I think we'll be able to minimize the spread of this.
Sure. And so you had mentioned tracers before. We hear a lot about tracing. Is how many tracers does New York City need? Where are we at? And how can people are there opportunities for people to get hired as tracers?
Oh yes. Oh my God, there's so many things I need to send you. I wish Adrian, my policy person, was on here, because then maybe Michael is on here from our press office. Yes, so their hiring is going on for contact tracing. We definitely encourage people to apply. It's so H&H is running that initiative. Everyone's working very feverishly to get everything started, hopefully in the next week or two. And the goal is to hire 2,500 contact tracers, because that is the ratio that has been estimated that will be needed in order to be able to once a case is identified, to then follow up on all the contacts. So anyone who's been with the person, close to the person for 15-30 minutes, I think is broadly considered a contact. And so those folks need to then be interviewed. And once they're interviewed, they need to be potentially quarantined or isolated. They'll be tested. If they're positive, they need to isolate either at home, or they can go to the isolation hotels that are available. Or if they test negative, they'll quarantine either at home or, so just so everyone knows, isolation is if you test positive. Right. Quarantine is if you've been exposed, but you're testing negative and you're waiting to see whether you develop the symptoms.
Got it. And that's going to be going on for a while, I would imagine.
Yeah. That's going to be going on for a while.
So there's a question from Facebook. What is your take on the safety of kids in the summer in pools and chlorinated pools?
Oh, that's interesting. I feel like, and of course, and I think this needs to be double checked. I feel like I heard that chlorine definitely does decrease the viability of the virus. I think the same issues stand in terms of like distancing and closeness. So maintaining that 6 feet, again, is going to be really important. You know, we are seeing, folks may have heard about the multi-system inflammatory syndrome in children, MIS-C, we're calling it. We're seeing, which appears to be associated with COVID-19 illness. So I think initially we were really excited because it seemed like children were being spared this, but the syndrome is admittedly quite frightening. And so I know a lot of parents are probably considering whether they should send their children to like summer camp and things like that. I would probably, I'm just speaking as a parent right now, definitely do whatever you can to like minimize whatever the activity is, to minimize the interaction that you have with other people who are living outside your household. And if you are going to socialize with others, just making sure that you have on your face covering, that you're maintaining that distance.
Yep. I think that's a great piece of advice is, listen, people are going to get out. It's warmer, right?
Yes.
Get out, but to minimize the time that you're with other folks, and frequency, I would imagine too, of the same people. So
right, and if it's going to be the same, right, and if it's going to be the same, and trying to like get together with some of the same people as opposed to lots of different types of people, keep the group small. I mean, even things like not sharing food, like don't do buffets. You know, because people can like cough over it. You know, utensils, not sharing utensils. Just, you know, it's sort of common sense.
Yeah, it's a new world. So everyone gets to order a la carte, I guess. Right?
Yes, exactly.
That's what we have to do. So we're almost out of time, but you know, you have given us so much time today, and I think I don't know if there's any last words you want to share before we close.
Sure. I mean, I think probably for everyone, you know, this has been a challenging time in many different ways. And, you know, our mental health and mental well-being is incredibly important. I have developed a meditation practice that I started pre-pandemic, but that has helped to keep me grounded. Finding one thing a day that you're really grateful for. So having a gratitude practice can really help. And also just getting out if you can. Just remember, if you have your face covering on, if you're staying away from people, that you're being safe. So make sure that you get out, that you're staying active. And I'm hoping we'll all get through this together, just a day at a time.
Yep, and that's it. We are in this together.
Yes.
And we're very thankful for all that you're doing and the New York City Department of Health is doing. You know, it's real important. You're always out there fighting for us. So, you know what, everyone out there, let's keep this conversation going. The advocacy and fight for our community is relentless. We can't stop. Pandemic doesn't stop the needs that we had pre-pandemic, and they've only increased during the pandemic. And so our organizing and advocacy efforts are going to be even more important moving forward. And just, you know, and just for our next town hall, which is next Thursday, May 28th at 11:30 a.m. Join us because we're going to have the United States Senate Democratic leader, Charles Schumer, here to talk a little bit about the federal response to COVID-19, how he's fighting for New York as his colleagues in the Senate and the president are not, and how we're going to get those aid to localities like New York City and New York State here, you know, so we can help those most in need. and also what we're doing to advance equality on the federal level. We have to remember that there are things that the Supreme Court is deciding on right now that are going to greatly impact our LGBTQ families. So once again, I want to thank Dr. Blackstock. We are going to put up all those incredible resources. You are amazing. You really are. You've been on the front lines for so many years for our community. And, you know, it just has been a pleasure and an honor that you have joined us.
Thank you so much for having me and continue doing the wonderful work that LGBT Network is doing. And I'm happy to be a resource. And just to say, the PowerPoint I shared, I can send it to you as a PDF, and you can also put that on your website. A lot of the links that I mentioned are in that.
Perfect. We will do that. So
okay.
Everyone out there, we're going to have all this stuff going up all day. And it's not just today. We're going to continue to post the great resources from the New York City Department of Health and the Bureau of HIV. So thank you so much.
Thank you so much. Stay safe, everybody.
All righty. Take care.
Bye. Bye, David.
Bye.